All glory is to God. I'm more than grateful to stand here and welcome all honorary colleagues of the new profession to the 95th Annual National Conference of the Pharmaceutical Society of Nigeria, TINCITY 2022. And I say, welcome to Jos, the city of peace and tourism. I call it the Paris of Nigeria. They say, go see Paris and die. Come to Jos and live. I say, a heartfelt thank you to all sponsors, as well as all our special guests and speakers at the plenary sessions. And to all, I say stay warm and enjoy as the event unfolds here in the city of Jos. Thank you very much.
It's infinite mercy for you to be here today. Today is indeed the day that our Lord has made. And under my leadership, we are highly delighted to host the annual national conference with the theme, Medicine Security in an Unstable Economy. Activities marking the successful commencement of this August occasion started on Saturday by the arousing reception accorded our dear President, Professor Cyril Usifo. While in Jos, the Plateau state capital, I wish you all a memorable conference and permit me to, on behalf of the Plateau people, to say, in Angas, we say, in Tarok, we say, Mbawu Kamba. In Gomay, we say Pongwem. In Magapul, we say Mumale. In Afizere, we say Kajaindi Kube. In Birom, we say Shoindebe. And in English, we say you are all welcome. God bless you. Welcome to Jos, the beautiful.
When you have been part of nurturing an association that is 95 years old, it always gives you joy and pride. Families in Nigeria are very special, and that's why we, as past presidents, feel always honored to be present at the Society's conferences. The Pharmaceutical Society of Nigeria, I always like to remind people, apart from being the oldest, is the best, comprising of trusted, tested, and forthright pharmacists from all walks. Wow. The College of Past Presidents seated here, adorned with their beautiful medallions, have been part of laying the building blocks that has brought us to this time.
It's really a pleasure to be here today as a proud Nigerian to speak to this wonderful crowd. Please give yourself a warm hand. And I'm not just speaking for myself. I'm speaking for the members of NAPSA who are here with me today. But before I go into that, for those of you who don't know about NAPSA, what does it stand for? What do we do? What is our goal? I'm going to give you just some few highlights. NAPSA stands for the Nigerian Association of Pharmacists and Pharmaceutical Scientists in the Americas. We are based in the United States. I guess you're going to ask, why are we here? We are here because a lot of us are Nigerians. And we care about what's happening in Nigeria. And we want to make sure that you all know, that we know and care about what's happening in our country. Now, I'm just going to pick one thing, one of the goals that we do. Now, our mission is to promote healthy living, disease prevention, through effective pharmaceutical care and facilitation of efficient healthcare delivery system and strategies in America. I want you to realize the next one: Nigeria, Africa, and the rest of the world.
Issues in health space in contemporary times remains the eventual ascent of the pharmacy bill, which has been in works for over 5 years. It is important that I set the record straight as far as the evolution of this Lifeline Act of Parliament in Nigeria. In 2014, the PSN mobilized its presidency, which was the driving force behind the Law and Ethics Committee to legalize the proponents of motions and resolutions at AGM and proceedings of summits held in 2002 and 2012. Some of the salient inputs from PSN into this act include: 1, introduction of satellite pharmacy concept to redress several years of glamour of the hospital, administrative, industrial, and academic pharmacies who wanted an extension of the window of practice at community level in larger bid to promote access to pharmacare coordinated directly by pharmacists. 2, the registration of hospital pharmacies in public and private sectors as approved by AGM in Ilorin, Kwara in 1996. Broader representation in the composition of the Governing Council of PCN to endanger all stakeholders buy-in as well as promote collaboration in regulatory activities between PCN and NAFDA. Also the clear and unambiguous functions and powers of PCN to inspect, approve, license, regulate all pharmaceutical premises, including PPMV dealers, satellite pharmacies, and pharma marketers who are non-pharmacists.
We are already making efforts. NIPRID has taken the lead, and we've secured a better part of $1 million from Afrexim Bank to say, let us develop our own API manufacturing and training capacity in Nigeria. Already happening. And then, all these things I've mentioned is on conventional medicine, so we haven't talked about the other side, where you have phytomedicines, of which, based on our topography, our soil conditions, our variegated climates, about 6, if you're counting from the north down to the sea, means that we have thousands of plants that have ethno-medicinal value that people come into Nigeria and make tons of money on, despite the fact that we have better plant varieties here and we have the capacity to develop them. And then, the AFCFTA. It is like a gift wrap to Nigeria. When I exited MG-Man 4 years ago as executive secretary, one company in PMG-Man, Rayfield, had innovated chlorhexidine for, what do you call this thing now? The navels of newborn children. It's an antiseptic gel to prevent infections. At that time, that company was exporting to over 10 countries in Africa. I spearheaded a move that took about close to 10 pharmaceutical companies to begin to break into Francophone West Africa. This was moves and initiatives at a time that AFCFTA did not exist and largely unbacked by government. Imagine now that you have an African continental free trade agreement that mandates you to buy from another African country rather than importing from outside Africa. Imagine the opportunity if we re-strategize for export. So I could go on and on and on, but these 6 points I mentioned will give you an insight as regards the why. The how, and my team and I debated this for a very long time. And we said it would be good to just pick out the 4 most critical and rank them in terms of priority. First is political will. Say anything you like about this administration. This administration has focused on enabling us to develop our own capacity by ourselves. Sometimes it has not been done very correctly. I'm a scientist and I will tell you the truth. Sometimes it hasn't been done correctly by the political stakeholders. But the gap is in their advisors, not in the political will. If you tell Buhari now that banning importation of medicines is what will make local manufacturers grow, he will do that. And there is demonstrable evidence, like I said. In the 2016 fiscal policy, this government ring-fenced 4 categories: antibiotics, antimalarials, alkaloids, and hematinics for local manufacture. And that led to a corresponding double-digit growth in factories within Nigeria. Similarly, Executive Order number 4F that was done by Professor Yemi Osinbajo when he was acting president singled out pharmaceuticals in section 4F, saying that government establishments must procure made in Nigeria medicines for use in their facilities. Is there an executive order? And then the minister mentioned bio-vaccines. How many governments across the world will put forward 3 billion naira of its own money to partner with a local manufacturer in order to produce vaccines locally? And this moved along within the past 4 or 5 years. So the political will is there. In terms of prioritization, those of you who are very good fact checkers, go back to President Buhari's 2021 speech. He singled out close to 7% of that speech, talking about pharmaceutical independence, research and development, and medicine security. It has not been done in Nigeria's history that in an Independence Day speech, that policy statement is made boldly. And I can tell you categorically that that statement has helped us to engage with partners across the world to bring in more attention towards pharma R&D. And then obviously the general systems approach, which we are, advocating. That it is not something that we'll all gather only ourselves in one room as pharmacists. We need to engage with other sectors and get them involved.
As we know, we've gone beyond the normal OTCs. We've gone into novel products, premium brands as well. And all those brands are manufactured here in Nigeria. We also have the vaccine group, Vaccines. Yesterday we had a training which we partnered with PSN on vaccination. We have the Zolon Group. Zolon is the ethical arm of the company. Pre-COVID, over 36 brands of Zolon were manufactured or imported. Over 36 brands imported. But I can confidently tell you that as we speak, 70% of our brands are manufactured locally in Nigeria.
The reason we signed the endorsement and the collaborations as a part of our CSR is to encourage people to use original, high quality, and authentic products with proper medications. We initiated a discussion with Pharmaceutical Society of Nigeria, and eventually we found a common ground through partnership to address these challenges, acknowledging PSN as a body of professionals, ethic, and discipline. Furthermore, this year, PROCO kicked off a campaign called #OriginalMovement. The aim of this campaign is not only to encourage Nigerians to only use original and authentic products, but also to call people to seek information and to understand thoroughly before consuming any drugs. With regards to this, we have collaborated with PSN to endorse this campaign as we jointly help Nigerians to live a better and healthier life.
Pleasure that I have the honor to present this message on the occasion of the 95th Annual National Conference of the Pharmaceutical Society of Nigeria in Jos, Plateau State. First of all, I would like to commend the National Executive of the Council of Pharmaceutical Society of Nigeria for organizing this event in Jos, the Plateau State capital. This goes to show and testify publicly that peace and stability have come to stay on the plateau. This conference with the theme Medicine Security in an Unstable Economy is geared towards improving sustainable access to safe, high quality and affordable health care through local production of medicines and commodities. This theme is carefully chosen and is in line with the three policy thrusts of our administration in achieving the universal health coverage for the people of Plateau State. Consequently, as a government, we have established the Plateau State Contributory Healthcare Management Agency, as chairman, which is currently providing health insurance to the citizens of Plateau State. We have equally timed the Drug and Commodity Management Bill into law, which will enable the citizens to have access to high quality and affordable medicines. Government, in its effort to improve the health needs of the citizenry, has approved the employment of healthcare providers in the services of the state health institutions. We believe this will go a long way in addressing the challenges being faced in the health facilities due to shortage of manpower. We are on the verge of completing the General Hospital and Trauma Center in Riom. Also, the General Hospitals in Kwal, Kanke, and the General Hospital in Mabudi in Lantang South. We are currently supporting the Plateau State Public Health Emergency Operations Center in curbing emergency diseases like COVID-19, monkeypox, Lassa fever, cholera, and others, which indicate the proactiveness of our administration towards emergency situations. In line with the above, we are keying into the National Emergency Medical Services and Ambulance System of the federal government. Distinguished personalities and resource persons, ladies and gentlemen, I wish to thank you and appreciate you all for not only coming, but attending this opening remark session and listening attentively.
PIs. You have a responsibility to transform this country from a vaccine consumer nation into a vaccine manufacturing nation for local use and for export purposes. We must leverage on the African continent free trade zone as a new frontier of international trade capability, capable of stabilizing our economy. The government will continue to create the environment that ensures that the Nigerian pharma sector remains continentally competitive in the short term and later globally. We look forward to surpassing the pharma sector GDP contribution between 1.5 to 2.5 billion US dollars to at least $4 billion US dollars in the next decade. This means the country will partly rely on the achievements of medicines and vaccine security to stabilize the economy.
The key objectives of the college is to train and produce specialists. As we all know, we're in the era of specialization. I normally say something. If you focus on your focus, then you will become the focus. We have passed the level of being a general pharmacist or general practice pharmacist. We want to recognize more and more people that are specializing in specialties in pharmacy. And I can assure you that is happening now. That is happening in most of our health institutions. And when we do this, we are impacting on the patient positively, and we're also impacting on our colleagues, from the medics to the nurses to everybody. When you specialize, you have an in-depth knowledge of that particular aspect of pharmacy, and people will recognize you for that.
One distinguished pharmacist colleagues to this opening ceremony, the 95th annual meeting of the Pharmaceutical Society of Nigeria, which is the first of the new presidents, and it's exciting to note that it is very well attended. Thank you, Plateau State, for the representation. The theme, medicine security in an unstable economy, is apt and timely in view of the current economic situation in the country, the skyrocketing prices of essential goods and commodities, and the unfavorable GDP coupled with the decline of the naira. The international market forms a critical mass of the source of our drugs, and the subject of medicine security cannot be overemphasized, considering its critical importance in healthcare delivery and contributions to universal health coverage in Nigeria and across the globe. Medicine security implies that every health facility, healthcare professional, healthcare provider, and patient everywhere around the world has reliable, equitable access to medicine supplies that they need to achieve good health at all times.
Attention to our current drug situation. Aside from the agency's effort in drug supply production, which includes successful clampdown on the cultivation, production, sale, importation, exportation, and interdiction of trafficking in narcotic and psychotropic substances. Part of the efforts to prevent the use and misuse of essential medicine is in the development of the 4th edition of the National Drug Control Master Plan, 2021 to 2025. It's a strategic document to strengthen responses to drugs to contribute to enhance health, security, and well-being of Nigerians.
What to use in fighting medicine insecurity. Natural medicine is one of the platforms we can use as a silver bullet in fighting medicine insecurity. Therefore, I am challenging the entire House today for pharmacists to come on board and join us in this fight. Nigerian Natural Medicine Development Agency has developed 14 products currently undergoing NAFDAC listing processes, and we are open for business. We have a facility, 4-story building facility, a new laboratory complex, which will soon be commissioned, and it has sufficient sophisticated equipment for analysis. We are open to university collaborations, research and other organizations to come on board to push this frontier forward. Permit me to mention this. As Natural Medicine Development Agency, we have paved way for pharmacists in such a way that the African Free Continental Trade Agreement Protocol is in favor of pharmacists. Please come on board so that you can take advantage of this platform.
Appreciation awards shall be presenting to Your Excellency, the Executive Governor of Plateau State, in recognition of your role as the host of the conference and in appreciation of the courtesies extended to the Society during the 95th Annual National Conference. Thank you very much, sir.
Express in-depth gratitude to the Almighty God for a special day like this. And I want to thank all that made today's event a tremendous success with your attendance. Our gratitude goes from the Pharmaceutical Society of Nigeria, goes to our host, His Excellency, the Right Honorable Dr. Simon Bako Lalong, the Executive Governor of Plateau State, for gracing this occasion and ably represented by His Excellency, the Deputy Governor of Plateau State, Professor Sonny Taudem. Well, in conclusion, a big thank to those who have remembered us in prayers. I know that the CPFN arrived there a weekend before to commit this program to the hands of the Lord, and those who have contributed in various ways and capacities towards the success of this conference. I pray that the Almighty God will lead us safely back to our various destinations after a successful outing in Jos Plateau. Thank you very much.
We have men of honor from different aspects of life. And even before me, we have another who is a pharmacist as well. So it's not just people who from various in academia and what have you, we've all come here together. We want to partner with the federal government. We want to stem the tide of pharmacists leaving the country. We want better services, better facility, so that pharmacy will be able to practice and provide essential pharmaceutical care to Nigeria. When that is done, and the opportunities are there, people will leave this country. People will always do the best and give the best.
We are here to celebrate my 5th national conference, annual conference of the Pharmaceutical Society of Nigeria, with the theme, medicine, security, and stable economy, of course. Where we're going to showcase a lot of things, and we're very happy this is coming at this time, when we have a well represented, and just to let the Plateau to know who our pharmacists are. We started actually from the airport yesterday, where we let people to know that these honorable men that has the bane to propagate good intake of medicines. But with medicines, we know, we believe that medicines are poisonous. Everything taken in chemicals are poisonous, and nothing are poisonous. Who are the managers of poisonous? So we want us to go first to know who pharmacists are. I think with the opening ceremony and subsequent things that will come on, we know who actually the pharmacists are.
Honestly, I think we must appreciate God and also appreciate the President and his team, and more importantly, the Conference Planning Committee and the people of Jos, like the keynote speaker, observes. Perhaps maybe not the best conference in the annals of PSN, but in actual sense, with all standards, in recent time, I think the Jos conference has proven to be one of the best conferences. So I think we have every cause to thank God and I congratulate the President for his first conference to have been like this. We should expect better days ahead in his term as President of PSN. So, today's opening ceremony has actually shown to us that Jos Conference is a conference of reference.
Doctor said, we wish the government will implement everything because it's about the best for us as a pharmaceutical profession.
It's been wonderful. Yesterday we had a good time. There was a health walk, which was very refreshing. And after that, there was a welcome party for all the people that came. And we bless God because God granted each and every one of us journey mercy. And this opening ceremony is a great one. The number of pharmacists here are very impressive. And our dignitaries that we invited, the majority of them are here. And the program is moving on to the glory of God.
Everybody come.